As an industry expert on not only data flow but operations, PharMerica brings together a unique group of leadership individuals from not only ownership but from the pharmacy side of our industry. And they have the chance to integrate information, hear a lot of new legislative and also policy information, and really have the time to share and bring their questions to the forefront. They also share their ideas about things they've used to solve their problems and try to work with all of these changes that we have in the industry today. So it's important as a leadership person in education to not only come and present, but to come and listen to what their concerns are. Well, we're on the cusp of this enormous change in not only the content of the data, but the utilization of the data that the facilities create for CMS through the MDS and the assessment data, as well as their claims data. And so with the changes in the data, we have changes in utilization, and a lot of ownership and corporate leadership have not really seen the whole picture of where the data is going to be utilized by CMS for payment, by the surveyors for the regulatory activities, and then also for their to manage their business. Analytics are very important today so that we can look at the data as a provider, just like CMS looks at our data as a regulator. Very, very important. The MDS is changing significantly in October, and we're going to have multiple pages of additional functional data that is going to be used then to evaluate whether our programs in the facilities, especially rehab programs, are effective. And then that data is going to be used with the new payment system, the PDPM, in October of 2019. And of course, that is going to be a dramatic change in the way that not only we're reimbursed, but our quality statistics are gathered. That is the key issue that we're dealing with today. The data, there are parts of the database that have to be absolutely perfect in order for the facility to be able to not only be paid properly, but to be able to get, be able to show the quality that their services really bring to the elders. And now we have person-centered care as a central part of the regulatory process, and that alone, showing that you're delivering person-centered care and what the outcomes of that care really are, because the outcomes can be fabulous, but you don't have any way to show that if your data is not correct. Now, the other issue is we have significant new data that has to be absolutely perfect. When CMS talks about accuracy in the tags, they mean it. And so even small mistakes have to be analyzed, and you have to go back and make sure that, human error, this is a big data set. This is a lot of work. And we still have the issue that these are human beings gathering data and putting them in. Sometimes they're tired, sometimes their equipment, their hardware and software are a problem. And so we need to be very, very careful. The other thing is when data flow is established, senior management must have caveats and parts of that data that they monitor constantly. And that is getting bigger and bigger as those caveats, those parts of the database that have to be very, very carefully managed are getting larger and larger. And so we have to have global understanding. We have to have good management that percolates all the way down into our frontline caregivers. Some of that data comes from what the caregivers do every day. And then when we get the data together, We need to be able to do good analytics so we can see what our trends are and how the information is going to be used on the outside. Well, working together, not only the performance of pharmacy with the facilities, but also the information that they're gathering and the standards that they're building about antipsychotics. The consultant pharmacist review now is a part of the database process, and there's also a rather significant number of issues, policy issues, that pharmacies have established good practice standards, and we're working with physicians. The consultant pharmacists at PharMerica have great relationships with medical directors. All of those things complete the picture because it's such a complex clinical world today, and medications are a central part of getting residents better. They can also be a part of residents having issues.